Miss PM, I'm going to be your nurse for today. I'm going to walk in, introduce myself to the patient. I'm going to check for the two identifiers, name and date of birth on a wristband. I'm going to check that wristband to make sure the date of birth is there. I'm also going to perform hand hygiene. I also want to give a 360 privacy. So as I'm walking into the patient, I want to make sure I observe the patient hair. Okay. I also want to see the color, the texture of the hair, whether it's gray, black, brown, any type of mixture, distribution of the pattern, anything in that nature. Also, I want to assess the texture, as I stated, see if it's coarse or fine hair, thin. Also, I'm going to examine the scalp of the hair. I want to see, is there any infestations? And I'm also going to wear gloves as well as I'm examining the patient. Then I want to go to the skin. I want to make sure the skin is intact. I want to look at the color. I want to look at, whether it's pallor, erythema, cyanosis, any type to that nature, whether it's jaundice, vitiligo, any pigmentation to the skin. Also, I'm going to examine the skin for any primary lesions or any mascules or papules, any distribution to that nature, any moles, birthmarks, ulcers. Then I'm going to go down. I'm going to be using my hands, and I'm going to assess the following both sides of the body. And using my hand, I'm going to use, the temperature. I want to use the back of my hand to check the skin on the forehead, the chest, the abdomen, and the lower extremities. I'm sorry. Also, I want to see if the skin is moisture. I want to use my fingertips. I want to check the skin. I want to see, is there any diaphoresis? I want to check the texture using my fingertips, using the skin checking the skin on the arms, legs, the trunk for smoothness, roughness, any flakiness. Also, I want to gently pinch or fold their skin under the clavicle, using my thumb and index finger. I want to observe how quickly the skin returns, how it comes back, actually. I want to see the position that the skin is in. I want to see whether it's abnormal or whether it's tinted or does it return back slowly. Assessing the nails as well. I want to see whether the nails is flat, spoon shaped, or clubbed. And I also want to see if the fingernails are color pink, pale, or discolored, anything to that nature. I also want to check the capillary refill. Same thing. I want to press on the nails, see if how it comes back. The index or middle finger, I want to hold it for 5 seconds, and then I want to release. Also, I want to note the time, whether it's +2 or 0 plus, or +2 seconds delayed. And I'm going to repeat on the other hand and both feet. Thank you.